Somebody having sex with one of your wives?
Yeah.
It happens.
Okay.
It happens.
So you could be married to those two, but then George can come and take one of them.
And also here the culture of getting married is, of course it is a rape.
Yeah, it's rape actually.
For them it is normal.
Yeah.
You don't go through this normal process of getting to friendship.
Yeah.
You just get one lady whom you admire, just organize and you rape her.
Yeah.
So then they give you the lady.
Once you rape her, you go with her.
They said some of them like have relationships because there is a detached that is around. So some of them have sexual intercourse there, so they don't know their health status. They would love to know their health status.
Are they married?
Yes, they are married.
And it's acceptable in the culture for them to have outside relations.
For them, they can have even more than 5 women.
And for the woman?
For the women, you're only supposed to have one man.
Through provision of HIV testing and counseling services, the Reach You project has managed to integrate other services like malaria prevention, hygiene and sanitation, family planning services and circumcision.
We integrate the HCT services with other services including family planning, malaria prevention, sanitation, good personal hygiene, and we refer the clients to nearby health facilities to receive these services. In case of young male or eligible male who are eligible for safe male circumcision, we refer these to sites where it is offered.
People are taught the major importance of the above. For example, for circumcision, many eligible males have overwhelmingly embraced and demanded for this service at the referral health centers in areas where they live.
We tell them the benefits of it, like some kind of phimosis and paraphimosis is reduced, reduction of cervical cancer and penile cancer is also reduced. Like there is what we call hygiene maintenance. It's one way of improving one's hygiene when you circumcise. It's only 60% protective, so which means you're not fully protected. It means that when you circumcise, you have to also use condoms, be faithful to one partner, or abstain.
The only main challenge is that when referral is done, the people cannot access services because referral centers do not have capacity to perform these services, and those with capacity are very far, up to 80 kilometers, and with limited staffing.
We have faced a number of challenges in the districts where we implement HCT. For example, I can talk about Karamoja. This is an area where we had not been before, but we managed to get there. The people are friendly. Our fear was the security, but this has improved over time. However, we still have challenges of reaching the hard areas due to the terrain. Sometimes it's rainy and the roads are bad, therefore the teams cannot access those communities where we do want to do HCT. There is a challenge of referring persons for treatment in Karamoja. There are few health facilities which offer care and support services, and people have to travel long distances to receive this care. Say from Kabong, you may have to access care in Moroto or even Mbale or Soroti.
Capacity building has been emphasized to strengthen the HIV counseling and testing services in the Reach You areas of operation. This project has trained over 1,500 health center staff in HIV testing and counseling, logistics management, and record keeping. The main challenge in capacity building is that in most cases, the trained staffs are transferred to health centers in districts out of the Reach You supported regions.
We've experienced some challenges in this. Most of the health workers that we train sometimes are transferred to facilities that we don't work well. So training has been an ongoing process so that we cover the gaps as and when need comes. We all know that also in these facilities there is a limited number of staff. the patients that come to these facilities are many sometimes compared to the load that the health workers have. And as a program, we've tried to address this by putting counsellors on the program to be able to help them. But on the whole, they are really trying their level best. Whichever facilities we visit, we find out that they are trying their level best to counsel and test most of the clients that come to their facilities. We have trained facility-based staff to be able to counsel and test the clients that come to their facilities. And as I speak, we have trained over 1,500 health center staff at the Health Center 3s, Health Center 2s, and the private not-for-profit facilities where we work. We have trained them in areas of HIV counseling and testing, provider-initiated testing and counseling, couple counseling, logistics management, laboratory management, and records management. And on, we still go back to them, mentor them, and we supervise them to be able to see that they are the right track of serving the clients that we want. They are counseling in the right way and also doing testing in the best way possible so that clients are given the results that they so need.
REACH-U has around 350 trained staff and 80 support staff who are all distributed in areas where it operates. The project is so keen at recruiting competent people with desired skills, and it attracts and retains staff. This has led to hitherto unknown results and revolutionized HIV counseling and testing.
Currently, MJAP employs 350 staff. 8 of those are supporting our project, the REACH-U project, and they are distributed in the areas of Karamoja and Central. Mostly we have the counselors and the lab people who are supporting these services. And as the Human Resource Office, we are keen at ensuring that we bring on board competent staff who have both the skills and attitudes to implement our projects. We've put in place policies to attract and retain these staff, and I'm sure that they are doing us a good job in the field, which is reflecting in the outputs that are coming out of our projects.
REACH-U has an efficient procurement system that supports the operations of the project. The procurement system ensures that there are adequate supplies in terms of pharmaceuticals, lab reagents, condoms, and other necessities. The supplies, transport, and other needs are efficiently made available to the health units. The project acts as a buffer stock for the continuity and sustainability of the project.
As a procurement section, basically our role is to give operation support to the REACH-U project, ensuring that the team has adequate supplies, both operational and those that we send to the facilities. The mode of operation is that since as a project, as REACH-U project, we work hand in hand with the health facilities, most of our procurements act as a buffer stock to the facilities, whereby we do not take the responsibility of the facilities, but we come in to ensure that there is continuity of supply. How do we do that? First of all, we help the facilities in ensuring that they submit their orders to national medical stores in time, so they're able to fall within the NMS schedule. Of course, NMS will supply to them, but due to the demands, some of these supplies are never adequate. So as the REACH-U program, we come in to fill up those gaps, especially the lab supplies and some pharmaceuticals like Septrin and the condoms. So as a procurement section, our role is to ensure that we bridge the gap, keeping constant flow with the facilities. And of course, as a program, we ensure that our procurements will go through a competitive procedure so that there is value for money in all that we do. From the facilities, we also do support, logistical support, in terms of distribution, we do engage a transporter who moves our supplies from our main stores here in Mulago to our area offices, and then the area offices ensure that the organized transport and move these supplies up to the last facility, close to a last mile delivery system, just like National Medical Stores does it.
The project conducts routine monitoring and evaluation. This is under the Monitoring and Evaluation Department. This ensures the project keeps on track in terms of realizing its objectives. According to the Monitoring and Evaluation team, has built capacity of staff to collect credible data which it shares with partners to improve service delivery. It evaluates how far the project has gone according to the objectives, the efficiency and effectiveness of the staff, and resource utilization in service provision. Accordingly, the project is at 70% performance level and will have realized its objectives by the end of 2014.
What we do here is we monitor progress of the project that we're implementing. When we're monitoring project, what guides us is the performance monitoring plans that we set here. Every activity that we implement contributes to an output. That output contributes to an outcome. At national level, we expect that outcome to contribute to what? To impact.
As a district, HIV/AIDS control is one of the high impact intervention programs that the district emphasizes when we are planning. And as a local government, we are experiencing a funding gap. And to come out of that one, we have a strategy of collaborating and working with development partners in the district, in the area of HIV. And one of the development partners we are working with is REACH-EU, that is supporting the area of HIV/AIDS control. And guided by Ministry of Health, one of the components where we are putting more emphasis in the area of the approach is the ABC strategy, whereby we emphasize HCT, that is counseling and testing for HIV. And REACH-EU or MJAP is supporting the HCT, that is HIV counseling and testing in Mukono district. During this current financial which I'm in, MJAP has prioritized the most at-risk population, whom we call MAPS. And they are handling a number of areas, especially in the islands of Kome, landing sites, and other areas which we target as most at risk. For example, the barracks, towns where they park trailers, and other areas that are defined as most at risk and most at risk population. And they are also handling at family level. And the approach is that they come parish. They make sure that they go house to house. And their model is that they handle a parish, do testing for each home. And when they have combed all the homes in that parish, then they move over to another parish. So we came up with bottlenecks, which we think, if addressed, can improve horizontally the quality of care and effective coverage, can address population demand for services. So when we identified these bottlenecks, so we are selling them out to these development partners. For example, the key bottlenecks that we identified was in the area of village health teams. Because we are having village health teams, and we believe that we can reach more people, we can reach more of our target for HIV and testing and other programs if we go through the structures of the VHT. And I'm glad that even REACH-EU, MJAP, is supporting the VHT structure, because through trainings, through involving them in other programs, for example, the PITC, Provider Initiative Testing and Counseling at health units, which is supported by MJAP, is all trying making sure that we improve coverage of the services.
for my family.
I am the leader of Kororo. This project has helped our people. Many people come from far to access these services, but with this team, they come to our homes and offer services to the Manyatas. We work together and they help us a lot, and our people have received services that we could not get for a long time.
Since the beneficiaries are part of the project, the reception of the project has been very good in the community. Our people have identified many people who are HIV positive, who didn't even know that they were HIV positive. So after identifying them, they have been referred to health facilities and they're able to access services early in their life, and it has improved their lives.
The project is supported by USAID technically and financially. This project is led by Dan Wamanya, who is the agreement officer's technical representatives. He ensures that the objectives of the program from the USAID perspective are achieved. The project works with him continuously in the field and in planning and implementation.
I came here with my colleagues to look at what MJAP is doing in Karamoja. This is my first trip to this region, and also the first time for my colleagues to be here. And it has been an exciting experience, looking at how things are going on here. The most interesting thing is that we have been able to work with MJAP and extend services to people whom I may call vulnerable people, because accessing services this kind of region and this particular area is not something that people can easily and ordinarily do. So we want to thank MJAP for making this effort, and we are happy that we are able to reach this kind of population.
Mata